With conventional insemination, we take a semen specimen, process it through a density gradient, so we isolate the most normal motile sperm from the specimen and use those to inseminate the eggs. So we just basically use a pure motile fraction of sperm and put a specified number of sperm in each dish of eggs. Assessment begins with retrieval. When the eggs are retrieved, the embryologist makes an assessment of the egg quality based on the cloud of cumulus cells surrounding the egg. After that, the egg is inseminated either conventionally or through the use of ICSI, and the egg is assessed for fertilization the following morning. So we look at the egg, we look for the presence of 2 nuclei, one from the male, one from the female, inside the egg to confirm fertilization. After that, the egg is assessed every 24 hours. So the following morning, we look for cell division. We look for that single egg cell to have initiated cleavage. So that initial 1 cell becomes at least 2. 2 to 4 usually on that first day of embryo cleavage. Again, we assess it the following day and look for continued growth. So we would look for cell development in the 4 to 8 cell range. At that point, we either transfer the embryos back to the patient or we continue to culture them for another 2 to 3 days. Again, we have an opportunity to assess development on subsequent days and identify which embryos have the best potential for establishing a pregnancy. So eventually, by day 5, we look for a blastocyst for transfer.
It's very important to have a Velcro uterus, and we really do a lot of things to guarantee that that is the case. So before the patient ever goes to in vitro fertilization, 100% of the time, we take a look inside the uterus with a relatively small telescope camera. The procedure itself takes about 30 seconds to a minute, minimally uncomfortable, if at all. And let's be 100% certain before we have these embryos in the catheter and are going to put them inside the woman's uterus that it's got a good home to go to.